Hi, my name is Atif Darwish, professor and consultant of obstetrics and gynecology. We face many questions from patients regarding the use of vitamin D for fertility purpose. Is it essential to get pregnant or not? And particularly, this question is common during the IVF or ICSI cycles. We have to know that vitamin D is considered as a prohormone. It is a fat-soluble vitamin, and it is called steroid, which is different from other steroids and has different forms. Uh, uh, and actually, we are using two important vitamin Ds in our body, which are vitamin D2 and vitamin D3. Vitamin D2 can be absorbed from the intestine, while vitamin D can be absorbed from the intestine, but mainly comes from skin due to exposure to ultraviolet uh, uh, rays. And the vitamin D2 and vitamin D3 are vital members and are associated with reproductive health uh, of the human beings. As I told you, the ultraviolet rays or beam exposes the skin and changes 7 dehydrocholesterol to vitamin D, which is cholecalciferol. And this is the main source of vitamin D, which is D3. 90% comes from sun exposure in the skin, and 10% comes from the diet. And also, diet may include vitamin D2 or D3. D2 is ergocalciferol. And this comes from some food like cod liver oil, milk, oily fish, mushroom, and others. By exposure to skin to ultraviolet in 90% and absorption from the intestine in 10%, these vitamin D2 and vitamin D3 are exposed to activation to be biologically active by a process which is called hydroxylation. The first hydroxylation occurs in the liver, 25 hydroxylation, and results to 25 hydroxy vitamin D or calcidiol. And then one hydroxylation occurs in the kidney, which is renal hydroxylation. And by this way, the 25 is exposed to hydroxylation at one link, which leads to active vitamin D, 125 dihydroxyvitamin D, which is calcitriol, which is active form of vitamin D. There is another hydroxylation occurs extrarenal in immune system, breast, colon, lungs, and prostate. And this is called extrarenal uh, 1-alpha hydroxylase enzyme, which leads to 125 dihydroxyvitamin D. So the inactive vitamin D is exposed to process of hydroxylation to be active. And by this way, this vitamin D will go to different parts of the body to start to function in the bones, in the genital system, in the immune system, and other target organs. What are the functions of vitamin D? We all know that it's the classic vitamin D effect or function is mainly for bones. It promotes bone formation, promotes bone resorption by increased number and activity of osteoclasts and calcium reabsorption in the kidney, phosphorus reabsorption in the kidney, and actually formation of 125 dihydroxy vitamin D. And in the intestine, it helps the calcium absorption, calcium binding protein synthesis, and phosphorus absorption. So the increased bioavailability of microbiome also and decreased opportunistic pathogens in the gut are related to the classic functions of vitamin D. So the bone formation and muscle and nerves and cellular functions are dependent on vitamin D. Extra bony effects or Non-classic effects include effect in the pancreas to affect insulin secretion, insulin resistance, and ovary steroidogenesis and folliculogenesis in the endometrium. It may help implantation and may improve endometriosis, and the pituitary gland for hormonal release and tests androgen senses, spermatogenesis, sperm maturation, and immunomodulator in the immune system. So the vitamin D actually is vital for many functions of the body. And regarding fertility, it's called the sunshine vitamin for fertility. Why it is vital? Because we found receptors in almost all tissues of the body, and hence it is implicated in a diverse number of physiologic functions. It has also been implicated in regulation of up to 200 genes. And in this figure, you can see it can affect the uh, whole human cycle, whether starting from gametes to pregnancy, childhood, and adulthood. And the vitamin D primary causes of exposure or affection of vitamin D in the body is exposure to sun and 10% in diet and sometimes supplements, and some modifying factors for vitamin D level in the blood include skin pigmentation, wearing sunglasses or clothes, pollution, smoking, alcohol, obesity, bariatric surgery, kidney or liver disease, genetic mutation, and other diseases. Vitamin D receptors are important in the process of fertility, and vitamin D metabolizing enzymes are found in the reproductive tissues of both men and women. So many studies have showed that vitamin D levels are associated with female fertility and healthy pregnancy outcomes. So the effect of vitamins, the active form of vitamin D includes steroidogenesis, gametogenesis, implantation, fetal growth, and maternal well-being. Why? Because it is an antioxidant and anti-inflammatory immunomodulator affecting placentation of the embryo by activation of genes related to implantation. Once vitamin D deficiency occurs, fetal growth restriction may occur. Also, it regulates menses and normal ovulation by stimulating folliculogenesis and calcium metabolism or effect in the ovarian functions. Also, vitamin D is related to some other diseases that prevents the occurrence of these diseases. And in PCOS, it leads to decrease increase sex hormone binding globulin. By this way, it will lead to decreased androgen action. And also, as I told you, it leads to decreased insulin resistance. In male, it improves sperm motility by increasing intracellular calcium concentration that leads to increased motility, in addition to induction of acrosomal reaction in capacitated spermatozoa. Some studies highlighted its importance in steroidogenesis, increased testosterone, but these studies are doubtful, but they relied on the presence of vitamin D receptors in the Leydig cells that may stimulate formation of pregnenolone in the mitochondria from cholesterol that is changed to testosterone in endoplasmic reticulum, and under the effect of 5-alpha reductase, it's changed to the active form, which is dihydrotestosterone. Okay, we have a patient try to start the protocol of IVF, ICSI, or even normal patient seeking fertility. We have to estimate the level of vitamin D. The Endocrine Society defined vitamin D deficiency as decreased the serum level less than 20 nanogram per deciliter. Normally, we consider vitamin D normal between 20 to 40, but the Endocrine Society consider 20 to 30 is insufficient and normal or sufficient if it is more than 30 nanogram per deciliter, which is replete. What is the incidence of vitamin D deficiency? It's very common, actually, incredibly common, and affecting up to 40% of population, and some studies from the United States found them representing up to 70% of population. In ART patients, the incidence of vitamin D deficiency in up to 53%, vitamin D insufficiency up to 30%, and the replete only in 16% of cases. The US recommended dietary allowance for most adults of 600 international units for vitamin D, who is at risk, who are not exposed to sun, as I told you, 90%, or have some problem in absorption or in hydroxylation in the liver or the kidney, as we already mentioned. What are the sequelae of vitamin D deficiency? The sequelae are decreased calcium, which are the classic functions of vitamin D, so reduction of bone strength and fractures, hematologic defects, including anemia, some effect hormonal endocrinal dysfunction leading to some infertility and defective steroidogenesis. As we know, it is an antioxidant, so if it is deficient, there is increased ROS, which is reactive oxygen species, that may lead to DNA damage and mitochondrial dysfunction, increased apoptosis, and decreased antioxidant, which is SERT, silent information regulator. All these factors will lead to imbalance of oxidant and antioxidant, and this may affect fertility. Moreover, the deficiency of vitamin D can lead to calcium dyssynergia and follicular development arrest that may lead to anovulatory infertility and menstrual disturbances. It leads to decreased sex hormone binding globulin and increased testosterone that may lead to hyperandrogenism, hirsutism, seborrhea, acne, and obesity at the same time, in addition to insulin resistance. So vitamin D deficiency can have many effects on the body, including regarding fertility, including PCOS, endometriosis, myoma-induced infertility, premature ovarian failure, defective AMH production, defective steroidogenesis, defective ovarian folliculogenesis, defective endometrial receptivity and implantation, and poor prognosis in IVF and ICSI, in addition to male infertility, as mentioned by some. Now, the common question, is it essential to give your patient vitamin D or not? Is it essential to request vitamin D testing for all infertility patients or not? The supporting evidence that giving its recognized safety, accessibility, and ease of administration, vitamin D supplementation could prove to be a cost-effective strategy to improve public health, generally speaking. And women with a level of more than 30 nanogram per milliliter will have increased live birth rate than women with lower vitamin D levels. And live birth rate in other studies found that vitamin D replete have higher live birth rate than deficiency or insufficiency. So vitamin D replete have been reported to have a higher likelihood of developing euploid plastocysts in IVF ICSI. And serum and follicular concentrations of vitamin D have been reported to be correlated with each other and with IVF outcome. So vitamin D deficiency is associated with decreased number of mature oocytes available in IVF cycle, decreased blastocyst formation. It is also reported peripheral blood cellular immune activation. As I told you, it is an immunomodulator, increasing natural killer cell production, increasing B cell proportion, and this may affect implantation. And this can suggest a systemic non-ovarian influence. Some studies found that the embryo quality and higher pregnancy rate occur with vitamin D supplementation, and this has been achieved in many studies and systematic reviews. Here is an example of a systematic review of 12 studies and found that moderate daily dosing of vitamin D supplementation could increase pregnancy rate, but failed to significantly alter implantation or chemical pregnancy rate. And in this study, there is increased just chemical pregnancy rate without improving clinical pregnancy rate due to vitamin D supplementation in infertile women with vitamin D deficiency. So preconceptional vitamin D level was significantly predictor of IVF outcome in a retrospective study. 11 studies suggested that the chances to achieve a live birth, post-pregnancy test, and clinical pregnancy after ART are higher in women who are vitamin D replete more than 30 nanogram per milliliter when compared to those who are vitamin D deficient or insufficient. A recent meta-analysis of some studies on vitamin D and IVF found that it may increase clinical pregnancy rate, but not chemical pregnancy rate, but not clinical pregnancy rate. Others found increased clinical pregnancy rate, and some others found improvement in implantation rate of vitamin D if it is added to the myoinositol, melatonin, alpha, lactoalbumin, folic acid in a pilot randomized controlled study suggesting a non-ovarian influence. But you can observe here that the dosing of vitamin D is different between different studies, and this is one of the contributing factors of the non-sharpness of recommendations of these studies. An observational study found that vitamin D deficiency is associated with decreased number of mature oocytes available in an IVF and decreased blastocyst formation rate. So the results are conflicting actually, and this can be attributed to the effect of vitamin D supplementation may vary due to the patient's ethnicity, limited number of countries, varying dosing regimen, as I told you, and with varying duration of supplementation. Other contributing factors for vitamin D and for fertility and for implantation and for ovulation and so are not included in these studies. So in conclusion of this short talk, I would say that vitamin D likely participates in the modulation of reproductive functions. The data of vitamin D and fertility are not conclusive, and the place of vitamin D supplementation before IVF has yet to be clarified. And vitamin D blood level of 30 nanogram per milli or higher are associated with higher pregnancy rate. Supplementing vitamin D has been shown to improve female fertility and pregnancy outcome. Studies have shown that vitamin D levels are correlated with sperm production and motility. The question, can we order for vitamin D routinely for all infertile women, particularly those subjected to IVF-XZ? The answer is difficult, actually. It's not recommended by all societies, but the ASRM found that, mentioned that if there is a deficiency in the patient's history, or if the level is low, the insurance will approve testing for vitamin D. You know, vitamin D is an enemy to insurance companies, and most of them refuse to approve its testing. So if the patient has a clinical presentation or symptoms of vitamin D deficiency or a history of vitamin D deficiency, you can order for vitamin D and insurers will approve in such a case. And don't forget to avoid excessive vitamin D because patients will usually overuse vitamin D and overtake vitamin D. And if the vitamin D level is higher than 150 nanogram, this can lead to excessive vitamin D or hypervitaminosis D, which is actually a poisoning of vitamin D, leading to symptoms like nausea, vomiting, weakness, disturbed digestion, and increased calcium level with stones and so on. So don't give the patient overdose, and it's better to estimate the level of vitamin D in blood rather than over giving the patients high doses of vitamin D. Thank you so much.